Now, memories of the COVID-19 pandemic are resurfacing after a Hantavirus outbreak linked to a cruise ship triggered global concern. Images of hazmat suits, isolation measures and contact tracing are once again making headlines after multiple deaths and confirmed infections were reported aboard the MV Hondius. Hantavirus is a rare but potentially deadly infection usually spread through contact with rodents or rats, their urine, saliva or droppings. While most strains do not spread between humans, experts say the Andes strain linked to this current outbreak is one of the few known variants capable of limited human-to-human transmission. The outbreak began during a cruise journey from Argentina, with the passengers later developing severe flu-like symptoms and respiratory complications. So far, the World Health Organization has confirmed multiple cases connected to this ship, with authorities across countries now monitoring contacts and strengthening surveillance. Health experts, however, say there is no reason for panic yet. The World Health Organization maintains that the risk to the general public remains low and believes the outbreak can be contained through timely public health measures. Still, the situation is serving as a reminder that even years after COVID, the world remains vulnerable to emerging infectious diseases, and that global travel can once again turn local outbreaks into international concerns. We have Dr. Ishwar Jilada, Consultant Infectious Diseases and Secretary General People's Health Organization, now with us on the broadcast. Thank you so much, Dr. Ishwar, for being with us. Talk to us about the hantavirus. How concerned should people in India be?
See, basically, hantavirus is currently only in few human beings globally. There are totally around 140 people are there on the ship. 3 people died and other 8 people are infected and confirmed infected. And from there it has to go to several places so that Indians should be worried. Currently, it is not possible that the infection will spread so rapidly. There are two issues. Number one, the replication factor or R naught. R naught, what we have seen during the COVID, particularly COVID strains of Delta and Omicron, it was R naught was 4 or 5. That means one person who is infected could infect other 4 to 5 people before that infection settles down. Here the R naught factor in this hantavirus is very low. It may be less than 1. So basically, when the R naught is less than 1, for your viewers, I would like to explain to you that if one infected person infects 5 people before the person's infection settles down, 5 will infect 25, 25 will infect 125, they will infect 625. But here, if R naught is less than 1, if one infected person will infect another 1 person. So that is the issue, that it will not spread so heavily as much as in COVID. The second major issue is that the death rate is much high in hantavirus infection, particularly the Andes variety or Andes strain of the infection. Now that causes Hanta respiratory syndrome or HRS as compared to other syndromes which are like hemorrhagic fever and renal syndrome. This is more fatal. Around 40% people die. In the other variety, which is the renal syndrome, less than 15% people die. And third and most important thing is that currently, because the infection could come to the human being to mind very easily, very early, and all containment measures are taken, I don't think it will spill over from there to a lot of people, and therefore we should not be concerned. The concern currently should be only for scientific community and the governments. Concern should not be for common people.
Should not be a concern for the common people, but what about the common people who are looking to travel overseas, especially Europe?
Please travel. If you are already scheduled, please travel. Nothing would happen to you. And this kind of scare people should not carry in mind, because you see what is we understand that is a global village. Any infection in one corner of the world will go to other corner so easily. And we have seen during COVID. But if you look at that, after COVID and before COVID, we had so many infections. The only important thing about human being and the infection is that in last 40 years, there have been at least 15 to 20 infections which were in outbreaks. and some became pandemics. Out of them, 70% of them are zoonotic. That means they're coming from animal to human being. And this is because of the animal-bird-human interface. That means human being for their own selfish survival reasons either eat lot of animals or they intrude their atmosphere. They go to forest, they would like to habitat forest. You see any forest area, any hill station, with buildings. So we are intruding the atmosphere of other animals and birds, and they were going to suffer because if you try to for your own selfish reason intrude, they will also try to intrude you. That's what is happening in the last 40 years.
Dr. Ishwar Jalada, the reason why I'm asking all this is that the hazmat suits, the contact tracing, all these are words that can really set off panic in the minds of people. What is the potency of hantavirus to become a pandemic? Is there any chances, or how far away are we from it?
I don't think hantavirus can become a pandemic.
Okay.
And the same thing is the opinion from the World Health Organization, Centers for Disease Control, Atlanta, USA, and also European Community the Prevention and Disease Control Center. So basically, we do not see that it will become a pandemic. Now, what is happening is because of a lot of media, and above media there is a social media. Anything happening is goes to everybody. Containment measures are to be taken by only governments and scientific agencies, and let them be alert, do contact tracing, do kind of different testing, do genome sequencing to find out what are the different varieties we are able to see. Is there any only Andes virus or there are other type of viruses? So let us study first properly. And secondly, for all of us, we just should hear what is happening. All big epidemics, they have become only from small outbreak to big. But all small outbreaks do not become big epidemics. So we have seen such epidemics. We have seen COVID. We had seen almost 100 years before which was Spanish flu. We had seen other epidemics like HIV or Mpox, etc. But Mpox also could be contained only less than 100,000 people in the world. Here in hantavirus, there are infections. We have seen, at least in China, that between 1950 to 2007, China itself had more than 15 lakh cases, more than 50,000 deaths. But there are different reasons, there are different varieties. In China, they eat everything, including rats. So human beings should be very particular what we are eating, what precautions we are taking. When you talk about rat means not domestic rat, it is a forest rat. So one should not connect that we have seen rat and we have seen kind of rat bite in India. Will that rat will cause any kind of a pandemic? No, I don't think it will cause.
Right, Dr. Ishwar Jalada, the reason why we're having this conversation is because hantavirus is spreading more and more. We have Spanish health authorities about the ship, and they're doing all that they can to contain. How soon or how much time do you think it would take to contain this hantavirus outbreak?
See, there are two incubation periods in hanta.
Okay.
Number one is once the person is infected, the person is infectious only in initial 4 to 5 days, maximum 9 days. Thereafter, after the infection, the person can get sickness up to 4 to 6 weeks, maximum 8 weeks. So what authorities are going to do, once they evacuate the ship of 140 people, the people from 20 different countries, ship is not docked, ship is in midway in water. By small boats, they are going to bring them and then send them to their different respective cities or stations, and where there are chartered flights being taken. So they will, before that, they will examine. If required, they will quarantine them. Quarantine can be for 9 days. It can be for 40 days. For 9 days to prevent infection from infected person to other people, and for 40 days or 45 days for those people who are infected or suspected to be infected, to observe what kind of symptoms they are getting. Are they getting any kind of symptoms like respiratory syndrome or renal syndrome? So these are the ways they are going to tackle, and they are being observed by very top big authorities like WHO Director General himself is there, Health Ministry people from Spain, they are there, and they have taken all basic precautions, and they are going to guide even those 20 countries from where the people will be going with hantavirus infection or suspected infection to those other people. So basically, and what they say currently, out of 140 people, most of them are healthy. They are being examined. Nobody is sick. Nobody is in a kind of a situation they are sick. So basically, all is currently good, and we should keep our fingers crossed and watch how they are managing and how they are able to help people.